Hello, my name is Patricia Alvarado. I would like to take a moment to speak about some of our quality improvement measures that we closely monitor throughout the organization. Hospital-acquired infections are infections that patients acquire while receiving treatment for another medical condition in a healthcare setting. These infections can be caused by bacteria, viruses, fungi, or other microorganisms and can occur in any part of the body. The most common types of HAIs include urinary tract infections, surgical site infections, bloodstream infections, and pneumonia. These infections can be spread through the direct contact with contaminated surfaces or equipment, through the air, or through contact with infected healthcare workers. Preventing HAIs is crucial in a healthcare facility. This can be achieved by following infection prevention guidelines through proper hand hygiene, sterilization of equipment, proper cleaning and disinfection of patients' rooms, and appropriate use of antibiotics. Healthcare workers should also be trained on the proper use of personal protective equipment to prevent the spread of infection. One such initiative is the Hospital-Acquired Condition Reduction Program. Under this program, CMS reduces Medicare reimbursement rates for hospitals with high rates of HAIs and other preventable adverse events. The program measures hospital performance based on several quality measures, including HAI rates, and adjusts payments accordingly. The HAC reduction program has been effective in reducing HAI rates and improving patient safety. According to a report from CMS, the program has resulted in a 21% reduction in HAIs, also known as HACs, between 2014 and 2017. The costs associated with medication errors include increased hospitalization, longer hospital stays, and increased healthcare utilization. Moreover, medication errors can lead patient harm, including adverse drug reactions and even death. Thus, healthcare organizations must implement effective strategies to prevent medication errors and improve patient safety. Each year, somewhere between 700,000 and 1 million people in the United States fall in a hospital. A patient fall is defined as an unplanned descent to the floor with or without injury to the patient. A fall may result in fractures, lacerations, internal bleeding, leading to increased healthcare utilization. Research shows that close to 1/3 of falls can be prevented. As of 2008, the Centers for Medicare and Medicaid Services will not reimburse hospitals for certain types of traumatic injuries that occur while a patient is in the hospital. Many of these injuries could happen after a fall. Fall prevention involves managing patients' underlying fall risk factors. Examples are problems with walking and transfers, medication side effects, confusion, frequent toileting needs, and optimizing the hospital's physical design and environment. Sepsis is the body's extreme response to an infection. It is a life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout our body. The Centers for Medicare and Medicaid, also known as CMS, services established in the Hospital Inpatient Quality Reporting (IQR) program, which requires hospitals to report on various quality measures. CMS reduces reimbursement rates by 1% for hospitals that are in the worst performing quartile of hospitals in the terms of adherence to the protocol. This program is intended to improve the quality of care for patients with severe sepsis and septic shock, and encourage hospitals to take steps to ensure that their patients receive the best possible care. The World Health Organization states that sepsis is a syndromic response to infection and is frequently a final common pathway to death from many infectious diseases worldwide. The global burden of sepsis is difficult to ascertain, although a recent scientific publication estimated that in 2017, there were 48.9 million cases and 11 million sepsis-related deaths worldwide. The Leapfrog Hospital Safety Grade is an A, B, C, D, or F, assigned to general hospitals in the U.S., rating how safe they are for their patients. The grade uses more than 30 measures, including rates of preventable errors, injuries, and infections, and whether hospitals have systems in place to prevent them. Safety grades are based on a peer-reviewed methodology calculated by top patient safety experts, and are 100% transparent and free to the public.